sometimes it's not work.
It's a lot of work. It's a lot of late nights that people don't see. They think it's a Monday through Friday 8 to 5, but
Nope.
all three of us can tell you it's not. We make it
It's
look
not.
easy,
Yeah,
but
it's not.
it's a lot of blood, sweat, and tears that go into to holding and taking care of the community.
Mark told me I had a fake maternity leave, so if that helps anybody to understand.
Yeah, yeah, because
You did.
but you're looking at three people who have similar mindsets when it comes to getting things done. It's like we're gonna go above and beyond to make sure that our community is taken care of and the job gets done and gets done on a satisfactory level.
That's right.
Mm-hmm.
All right. So with that being said, we've talked about neighborhood before, but we want you to brag on neighborhood. So kind of give people, for those who don't know, this is their first time watching this podcast, give them an overview of what Neighborhood Medical Center is and how we serve the population and how you are able to serve the population as a CEO of Neighborhood Medical Center.
So, for those of you all who have been hiding under a rock and don't know about Neighborhood Medical Center, we have been around since June of 1974. We started out as a small clinic for uninsured or and homeless. We've since then grown. We had our main location, the hub was at the Brevard Street location inside of the Lincoln Center. From there, when we expanded our services, our service locations, we went to the Smith Williams Center over on Pasco Street, and we opened a health center in Havana at the Cecil V. Butler Health Department building. Those two locations are still alive and well and thriving. From there, we expanded through a new access grant, we expanded to the Orange Avenue location. Orange Avenue is inside the Richardson Lewis Health Department building. We also have a mobile unit for that location. From there, we opened up a school-based clinic in Havana and at James S. Ricketts High School. So in the Havana Magnet School and at James S. Ricketts High School. Now, with all those locations, we have a new one coming soon. Neighborhood Medical Center, again, on the south side of Tallahassee. Very proud about that. But in those locations, we provide primary care, mental health services, dentistry. We are very proud to have an OBGYN program. Neighborhood, we are taking care of babies. We have a pediatric program where those babies, when they're born from the OB program, mom can take them right over to our pediatrician. We're very proud of all the services we provide. I must also say that we have case management services as well. My job here is to make sure that the day-to-day operations are taken care of at Neighborhood, and to make sure that Neighborhood is visible so that we can fulfill our mission of taking care of people, making sure that people have access to primary care. So that's done in many facets. I'm out in the community, even though I don't like to be on camera. I don't want to hear the sound of my voice on TV. I hate doing that, but it's the nature of the beast. It's what you have to do. The job, again, is to make Neighborhood a lot more visible and to make sure that people know of the services that we have, so that if you know someone in need of those services, you just send them right over to Neighborhood and we can take good care of them.
That's it.
In a nutshell, look, come to Neighborhood. NeighborhoodMedicalCenter.org. Don't forget.
Yes.
Right.
All right. So that goes into, Ms. Freeman, can you tell us how FQHC provides medical services different than a health facility that is structured more traditionally?
I don't know if I would call it different, because to me it's the same level of service, if not maybe more detailed. We have more people, a teamwork approach to integrate, a teamwork approach to how we provide healthcare. It's integrated services. So it's a treatment team approach. So if you come here for primary care, you're just not going to come in here and get a physical. We're going to make sure you get dental. If you're in need of mental health, you can get that. If you're in need of case management, you can get that. We're going to give it all to you. If you're in need of outreach and education, you're going to get that too. So as far as quality goes, there's no difference. It's very high quality services that we provide, but we're able to provide additional services that our patients usually need.
So what are some of those like additional services? So if I was a patient and I came and said I needed some assistance with maybe a blood pressure medicine that I couldn't afford at this one place, is there places that we like not like refer, but tell people, hey, you can get it cheaper at this place, or do we offer programs and things like that that can assist? Or
Definitely. Through our case management program, there's a patient assistance program. We also, as a federally qualified health center, one of those benefits is being able to have a 340B pharmacy program so that patients are able to receive, eligible patients are able to receive their medications at little to no cost. So that is definitely a perk and a difference, as you said, Mathias, in being able to get services at neighborhood.
okay,
We want to make sure that our patients can get as much as they can in one stop, because
Right.
most of the people we take care of, they need that type of service. It may be difficult for them to get here. Transportation, we don't want to become a barrier for access to care. That's the goal, making sure people get what they need when they come the first time, and then
Gotcha.
they come back.
Gotcha. So that's so that would be one of the advantages of a FQHC
Oh,
is a one-stop shop
one
for
stop shop.
patients. Okay.
Yes.
good.
Okay.
So y'all
Okay.
come check us out now. We a one-stop shop now. We want to see more of y'all
Right.
come out here that don't
Right.
know.
Don't
Oh,
run
yeah.
to the emergency room.
No,
Come
come
to
here.
us.
Get preventative care. Let our physicians, our nurse practitioners, our pharmacy educator, let these people take good care of you. We're here for you. It is no reason for you to have to go to the hospital for emergency care when you can come here from the beginning and get preventative care. We want to keep people out of the hospital. We want to make sure TMH and Capital Region are able to deal with the emergency situations that they're there for. Let us take care of the preventative stuff and keep people healthy and out of hospitals.
Right. Right. Exactly. So neighborhoodmedicalcenter.org.
Yep.
Cool. So when we're talking about like women's health,
Mhm.
specific for neighborhood, what services, because we talked about OBGYN and things,
Mhm.
but what other services do we have that will help address some of the women's health issues that we would find in our Big Bend area?
Okay, so we have Dr. Kirksey is our certified diabetes educator. So we have a lot of women who suffer from diabetes or are at that borderline where their A1Cs are pretty high, not within normal range. So we have those options for ladies to come in and have that diabetes education, that nutrition counseling. And it's not just for the patient. We want to bring the family in, because a lot of times it's not the patient that's buying the groceries, it's not the patient
Right.
that's doing the cooking. We want to make sure it's a holistic approach to disease management. Women can come here and get their well woman visits, because you don't necessarily have to go to OBGYN for that. Come here and get the pap smears, breast exams, mammograms. All of those services are specific to women, and we can do those here on a daily basis.
Right, right. And that's, to me, that's so important. But also, I what I like is the amount of knowledge and care that you're gonna get. So because you go see the provider, and the provider, if even if the provider doesn't look like you, the provider can understand you.
Mhm.
And I
And
like that's what we bring to the table.
we have a good representation of making sure that our providers look like the people that we take care of. That is very important.
Yeah.
There are cultural differences that we must take into account. So if I come somewhere and you look like me, at least you can kind of understand where I'm coming.
Right.
That makes a big difference in people accessing healthcare. And it takes a special person to work at a health center,
Yeah.
because these are people that our patients, they become your family. They call you all times a day. They send you messages through the portal. They show up and be like, hey, I need you to put me
Hey.
on such and such schedule, and you
Mhm.
better do it,
Right.
because
Right.
that's just the type of
Look.
rapport that our providers have built up with our patients, and that's what you want. When it's time for our patients to make decisions, they don't feel alone. They know that they can come
Yep.
and talk to their healthcare provider and neighborhood, and they will make an educated and informed decision. So our providers are just amazing. I
Yeah.
can't talk about them enough. We have a good group of providers, and I'm very proud to work with them all.
Was always fun as well. Like our nurse, Miss Marcia. She has a fan club with a waiting list.
Yes.
Does.
Yes.
Like, and so that's what's so cool about it, because we've all witnessed on several occasions somebody say, I want Miss Morris. I'm looking for Miss Morris.
Where's Miss Morris? I'm a
Right,
caller. Like,
right.
okay, we're not scared of her. If you have her number, call us.
Yeah, yeah, but that's just so cool. But
And
also,
that's definitely a compliment to the providers
yes,
that our patients seek them out, and it could just be word of mouth. Well, Miss Morris, I heard this, or and these patients come up here and they don't want to just talk to Miss Morris or Miss Steeple or Dr. Richardson about healthcare. They want them to help make other decisions, and so that shows the amount of empathy and compassion that they have for the patients that they take care of. It really is something to be proud of.
yes.
And we get it all the time too, because we had a patient the other day call and say, my friend is the patient of Miss Steeples, and I want to see Miss Steeples.
Mm-hmm.
I'm like, okay, well, we got to talk about some things first. So Miss Morris, and see, well, what do you need? What they said, Miss Steeple is the best provider in the world, so I need to see Miss Steeple or Miss Morris. And this, and I was like, it just don't work that way. But
Right,
we gonna figure it out.
You just okay. Let me see where I can put you in on the schedule
And see what they say. And they get mad too when you move them and say, no, I can't see these people. They get real mad and they call the provider and say, hey, they said I can't see you.
Mm-hmm.
So I mean, but that is a good problem to have in the community that especially we serve.
Definitely.
Right. I do want to ask this question though about the women's health, and just for a better understanding from a male perspective and for our other males listening. So when you go to the doctor for your personal health care, and you don't have to get fully into details, but what are some thoughts that you have that may be negative, or some trepidation that you may have when you're going to get health care, that you just don't want things to go wrong, you want things to go right? So like, what are some of the thoughts that you have, or some of the fears that you may have when you go in to receive health care?
I mean, the first thing is, okay, God, when I go to the doctor, they're gonna tell me I need to lose weight. When you go, you don't want people to feel bad about that kind of stuff. You want people to say, hey, okay, we know that may be identified as something that's going on. We're gonna work with you, get you to a point where you're healthier and you're doing better. So, people have that kind of intrepidation. What is the doctor gonna tell me? I'm scared. But this is not a place for us to be scared. We want to identify the issues that you're having and help you get on the path to healing. That's what this is all about.
Right. You heard it. So, but yeah, that's what I just want to make sure that people get a good understanding, because yes, even you, somebody who's knowledgeable about the healthcare system, you still have things that you worry about when you go
you have your anxieties. You have, well, my skin is doing this. What am I going to do? Or it's just anything possible. Especially when you have little kids. You want to be able to come somewhere, and if you have 1,000 questions, the providers that we have will answer every one of those questions for you. And trust me, having a new baby, there's a lot you forget. When your kids are older. So I'm just like, let me ask. I'm having to write down questions. And that's the best thing you can do. That's what I do when I go to the doctor. You should do that when you go to the doctor. Ask questions, because that's the only way you're going to learn and become educated.
Right.
And our providers, if you have a good provider like we do here in the neighborhood, they don't mind answering those questions. They want you to come with those questions because they want you to leave more educated about your health.
Right.
And that's what we always talk about in the community too, is telling the people that they have to be their best advocate. The best person to advocate for yourself is yourself.
That's
and
right.
You have to be that person. But if you don't ask, we can't help you.
There's no dumb question.
We can't read.
Right.
I mean, it might seem dumb to them, but it's not going to be dumb to us. We're going to be like, okay, well, let's answer this head on.
Especially if it changes your health outcomes in a positive way. It can only help.
That's true. That's true.
So can you name something? I know we always touch on women's health, because you know what I'm saying, women are the lifeline of the community, because like you said, there's a lot of single mothers out here, there's a lot of things, not saying anything bad about the men in the community itself, but women are most of the people that keep us together. Your grandma holds you together, most of the families, the mom holds it together. And so can you just tell us some of the common services that NMC addresses specifically to women's health and how important it is?
So just when it comes to general health care, hypertension, hyperlipidemia, diabetes,
Okay.
abnormal pap smears. That's definitely one that we want to make sure that you get your annual pap smear. Come on in, let the providers do your exam, get your results back, and if it's abnormal, we need to take other steps to figure out what's going on, and get you